What delays Parkinson's biomarkers getting to patients? Imagine trying to catch a glimpse of a hidden puzzle piece that could tell you if someone is developing Parkinson's disease early on. That's what biomarkers aim to do. But getting these biological clues into everyday medical practice takes time and effort. The first challenge is that many promising biomarkers, like abnormal alpha-synuclein protein found in spinal fluid or skin biopsies, have only recently been validated with high accuracy. For example, the alpha-synuclein seeding amplification assay can detect misfolded alpha-synuclein with about 93% accuracy, but this breakthrough only happened in 2023 after decades of research. Turning such discoveries into routine tests requires extensive validation across different groups of people to ensure they are reliable and consistent. Parkinson's disease is a complex condition. Its symptoms often overlap with other neurodegenerative disorders like dementia with Lewy bodies or multiple system atrophy. Many biomarker tests, such as the SYN1 skin biopsy test, can detect abnormalities in synuclein proteins but cannot always tell Parkinson's apart from these related conditions. This makes diagnosis tricky and means doctors need to combine biomarker results with clinical evaluations, which adds more steps before these tools can be widely used. Another hurdle is finding biomarkers that are both specific and sensitive enough. Researchers have proposed many potential blood, urine, and imaging markers, but many show inconsistent results depending on the stage of the disease or the individual. For example, blood-based markers like epidermal growth factor, or APO, A1 show promise but often vary across patients and disease stages, limiting their immediate usefulness in clinics. Regulatory and practical issues also slow down the process. Before a biomarker test can be used widely, it must go through rigorous clinical trials to prove it benefits patients, is safe, and is cost-effective. Developing standardized testing protocols, training healthcare providers, and securing insurance coverage all take time. Currently, Parkinson's diagnosis relies heavily on observing motor symptoms, which often appear years after neurodegeneration has started. Biomarkers hold the promise of diagnosing the disease earlier, but integrating these tools into everyday practice requires changes in how doctors diagnose, educate physicians about new tests, and adapt patient management strategies. Funding and resources are also critical. While research initiatives have sped up discoveries, sustained investment is needed to support large validation studies, develop biobanks, and refine testing technologies. In summary, the delays in bringing Parkinson's biomarkers to patients come from the need for thorough validation to ensure they are accurate and reliable, the complexity of diagnosing Parkinson's disease, the lengthy regulatory approval process, challenges in clinical integration, and resource limitations. Overcoming these barriers is essential for enabling earlier diagnosis, personalized treatments, and better outcomes for those living with Parkinson's. Always remember, if you or someone you know is concerned about Parkinson's, consulting healthcare professionals is the best step to get personalized advice and care.